U.S. health officials put out new guidance today about the Zika virus. For the first time, they recommended that men who have traveled to an area with Zika should use condoms if they have sex with a pregnant woman for the entire duration of the pregnancy. The CDC also says those men may want to consider abstaining from sex with women who are trying to get pregnant. While the disease is overwhelmingly spread by mosquitoes, questions about 3 possible cases of sexual transmission led to these new guidelines. In Brazil, Zika has been found in the saliva and the urine of 2 people, and more than 1 million people there are said to be infected with Zika. Our science correspondent Miles O'Brien is covering the story. He joins me now from Recife, Brazil, where Carnival celebrations are beginning. So, Miles, this is a country that's hardest hit. It also happens to be you're there at the time of this big annual holiday.
Yes, Judy, here we are in the middle of this public health crisis, and this celebration, this national holiday, begins on this night, Carnival. What's interesting about Carnival is that at the very core, the philosophy is forget your troubles and party like there's no tomorrow. That's how the Brazilians view it, and that's why, in most cases, the party has gone on. I talked to a lot of public health officials and doctors and scientists who've been involved in this hunt for some action and some way to control the Zika outbreak. And many of them expressed misgivings about it, frankly, but the show is going on.
Now, Miles, we know the Centers for Disease Control said today that the cooperation with Brazil is getting better. That's the CDC here in the U.S. But they also have expressed some frustration about not getting enough data from down there. What do you know about that?
We heard a lot about this when we spoke to some of the scientists on the front lines here, some of the epidemiologists and the virologists who are working on this scientific riddle. This is a virus that has presented a whole new problem for them, and it's a virus, like so many things these days, that instantly become a global problem. The problem is there's legislation, there's law in this land which makes it all but impossible for them to share samples with their colleagues in Atlanta or Glasgow or elsewhere in Europe. And so they've been frustrated by that inability to share their data. Having said that, in a briefing today, the head of the CDC, Tom Frieden, said that is improving. But it's a reminder that when you're in a situation like this with a fast-moving virus, it's time to bring all kinds of borders and privileges and scientific prerogatives down and try to fight the problem.
And Miles, for the medical profession, I know you're talking to physicians there, researchers. You were saying this has to be very frustrating for them, that they don't feel, you said, that they have the tools in the toolbox that they need.
I spoke to a gynecologist today who's dealt with several mothers who have had to contend with this, and she's so frustrated. As she said, I feel like I'm in the Stone Age. I can see this coming, I see the problem developing, and I have no tools in my toolbox to help these women. It's an unfortunate case. They've got this virus that came out of the blue, and they really don't have a way of coping with it right now.
And Miles, in terms of the science of it and dealing with the mosquitoes who are carrying this virus around, what about that front? Are they able to, are they able to project any kind of precautions that can be taken? Where are they on that front?
Well, obviously, they're telling pregnant women to be very careful and to guard against being bitten by mosquitoes. It's worth mentioning that those are the people. It's the pregnant women and don't get Zika. 4 out of 5 people don't even know they've had it. So part of it is public education. Part of it is going through and doing some spraying, which has limited efficacy. They've got 200,000 troops in the military knocking on doors, looking for standing water. But ultimately, they're way outnumbered by the mosquitoes. We were at a lab just the other day where they're actually genetically engineering mosquitoes, male mosquitoes, to mate with females, creating progeny which will die.